thank you all for coming. I was inspired to give this lecture by a patient of mine who we share stories about crafting, knitting, and crocheting all the time. And there's definitely a big connection between our ergonomics, the way that we move our body, and the way that we perform some of our favorite crafting and the things that we love to do. So I'm going to share my screen here. Bear with me for a second. All right, Corey, can you see my slides and hear me now?
Yes, both look good and sound good.
Okay, perfect. Oh, and then hang tight here real quick. Oh, sorry, one more time. Sorry, it's finicky when you want to share slides and not share other tabs.
Yeah.
Okay.
Oh, so I'm not hearing you at the moment. I just see the screen there.
I'm trying to share. I'm trying to share without it taking over the audio. One sec.
If you start it and it mutes you, I can ask you to unmute through Zoom.
So it's not giving me the option to unmute once I start sharing, but let's try this one last way here. I think this might do it. Okay, can you hear me?
I can hear you. I see the title screen too.
Okay, perfect. I think we're good now. All right, so some acknowledgements to begin with. A lot of the content for this talk is going to be inspired from the book Knitting Comfortably, The Ergonomics of Hand Knitting by Carson Demers. Carson Demers is a physical therapist by trade, but also a master knitter, so he brings a lot of really good information to the table in terms of people trying to remain skillful and productive knitters while also protecting their bodies. And then just as a caveat, I am a physical therapist first and a crafter second, so I'm still pretty novice at crocheting and really have very little experience with knitting. However, it's a big interest of mine, and in college I even started a little small business with one of my roommates selling some handcrafted headbands and hats to our classmates. So I'm definitely coming from this coming to this lecture from the perspective of a physical therapist, and chances are a lot of you know more than me about knitting and crocheting, but hopefully I can shed some light on the ergonomics and musculoskeletal side of things for you. So diving into ergonomics here, Carson Demers uses a really good analogy of talking about ergonomics like a three-legged chair. So on the seat of the chair, we have your comfort and environment, the environment being where, how, and with what you're performing, whatever activity you're performing, in this case, knitting or crocheting. And then comfort would be your benchmark for success. So if you're sacrificing comfort to complete a project, or if you're sacrificing the project to be comfortable, those can sort of be at odds with each other. And then the three legs of the stool are all important in their own ways and all need to be preserved evenly. Overemphasis on one or underemphasis on another is going to make that stool wobbly, and then your productivity, your comfort level is going to suffer for it. So when we're talking productivity, this is sort of why we're doing what we're doing. We're trying to either complete a project, learn a new skill, use our creative muscles. That's how we measure our productivity, is achieving what we're trying to achieve. Efficiency is measured more as the ease with which you perform a task, the speed, and trying to avoid waste. So what's efficient for some, such as continental style, may not be efficient for others who perform more English style knitting. And then finally, safety is going to be more of the positioning, the types of tools that you use, and the repetitive motions that go into the knitting and crocheting that all has a cumulative load on our tissues. So overemphasis on one tends to have negative effects on the other. So if you are overemphasizing safety and having perfect posture, perfect ergonomics with your movements, you're probably not knitting very quickly and being very productive with your projects. And conversely, if you're being overly productive and trying to pump out a lot of projects, maybe you have some deadlines or some birthdays that you're trying to meet to complete these projects by, you may be sacrificing some of your safety or efficiency for that. So it's important when we're thinking about these types of recreational-based injuries to know how we get injured. And it sort of falls into two big categories, either repetitive motions or prolonged motions. So we can call these sort of cumulative trauma disorders, where either by multiple repetition or prolonged positioning or overloading in one positioning, we can create tissue trauma. One of the biggest things we see is tendinopathy, and this is previously known as tendinitis. The name has since been changed because the itis implies that there's inflammation involved when that's not always the case. So with tendinopathies, your tissues, in particular your muscles and tendons, are having a failed healing response after being provoked with activity. So that can either be by overuse repetitively or one big rapid overload that it gets. So this would be if you repetitively chop onions versus if a box falls on your shoulder. That would be repetitive versus rapid overload. Neural compression is the second category here, and it refers to the irritation of a nerve. So in order for nerves to be happy, they need space, movement, and blood supply. And you can sort of think of your nerves as cooked spaghetti. So they are the length that they are. They don't get longer or shorter or stretch and contract, but they should be able to wiggle back and forth pretty nicely. So if that limp spaghetti in our arms and necks and legs is being restricted in any way, that can create neurological symptoms such as numbness, tingling, or feelings of weakness. And most commonly when we're thinking of crafts that we do with our upper body, that's going to be the median or ulnar nerve that's going to be affected, and we'll dive more into that later. Third on the list, we've got lumbar or cervical pain, and this is often related to prolonged positioning with knitting and crafting as compared to repetitive motions, because you're probably not moving a lot most of the time when you're crafting. Or interestingly, your neck and your back can become aggravated or irritable by abnormal breathing patterns, which again, we'll dive into a little bit more later. And then as a caveat as well, some other unhappy scenarios that can sometimes rear their ugly head when we're crafting a lot or knitting a lot is deconditioning. If we're spending hours and hours a day sitting and crafting, then we're sort of doing that at the sacrifice of our cardiovascular system. Or DVT, deep vein thrombosis, which refers to a blood clot. And if anyone is experiencing venous insufficiency or any arterial disorders that impact the way that blood is moved through the body, then you may be at increased risk of forming a blood clot when you're spending prolonged periods still or prolonged periods of pressure in a chair. So diving into number one here, tendinopathies. Again, they're created by either repetitive overuse or rapid overload. So I broke this down into sort of the three most common ones that are seen when referring to knitting and crocheting. The first one being your rotator cuff, which are the muscles of your shoulder. And these muscles are always on. So it's commonly thought that your rotator cuff muscles are only aggravated with movement. However, your rotator cuff muscles are working all day long to keep the head of your humerus onto the socket of your scapula. And the socket of the scapula is a lot smaller than the head of the humerus. So you can picture it as almost like a golf ball on a tee. It's not like it's just suctioned right into the tee or the socket of the scapula. It actually takes quite a lot of muscular activation to maintain that suction and keep the head of the humerus in the scapula. So anytime we're crafting with our arms in front of us and our elbows are unsupported or carrying a heavy bag over one shoulder, even though we're not doing any heavy lifting or movement overhead, those rotator cuff muscles are constantly working just to maintain your humerus in contact with your scapula or shoulder blade. Second one here is going to be more lateral elbow pain, lateral epicondylalgia, or more commonly known as tennis elbow. And this refers to the muscles of the wrist and fingers that contribute to wrist extension or pulling towards the backside of your wrist, finger extension, straightening the fingers, and radial deviation, which is the movement of your wrist when you are moving towards your thumb side. And these are all super common movements that we're using when we're knitting and crocheting, when we're most often with our hands extended or with slight radial deviation to do any of the yarning as we go. And what most commonly happens when people are experiencing lateral epicondylalgia is that persistent or consistent use leads to micro tearing of the muscles. And micro tearing of the muscles is very normal. Anytime that you exercise or exert yourself past a normal level, you have a level of tissue breakdown that then with rest and recovery, your body responds to that by laying down more muscle. So it's a very healthy process that we all use to maintain our strength and build our strength. However, when there's inadequate healing time, so if you begin knitting and you are doing that motion repetitively every day and for long periods without much rest, that doesn't allow enough time for your body to lay down more muscular tissue. So that sort of ratio of breakdown to build up starts to become imbalanced, and that tends to be pretty painful when that imbalance shifts the wrong way. It can also be provoked rather than repetitive motions, more of those low load, long duration positions. So tensioning a yarn with an outstretched fingertip, or pinching a piece of yarn for prolonged periods of time. Even though you're not doing a huge movement, your tendons are working at a low level for a long period of time. And then finally down here, this would be more of a tendinitis of your thumb muscles called de Quervain's tendinopathis, or text thumb, and that affects the muscles on the outside of your thumb. And those are most frequently aggravated with those prolonged pinching, gripping, or holding positions where those muscles just aren't getting the chance to recover and rest in between. And again, this is going to show itself quite a lot with any sort of faulty yarn tensioning techniques, especially the English style, where people have a tendency to pinch the yarn rather than tense it by wrapping around either the hand or fingers. So here's just another representation of those two types of tendinopathies that can develop, the overuse versus the overload type. So on the left graph, we have time on the x-axis and force on the y-axis. That black line that's spiking up and down is the repetitive use you're getting over days. So knitting, we could picture each of those spikes as one event of knitting. And the red dotted line shows our normal tissue tolerance. So starting early on the x-axis, that's pretty high up, and there's a lot of margin of safety between the amount of force that we're applying and the level of tissue tolerance that would lead to pain. But with repetitive use, when that tissue doesn't get enough time to recover and build back up in between, its tolerance starts to dip down. And when we get past that level where tolerance is lower than the same level of force that we've been applying this whole time, that's when we can start to experience pain or injury. And then on the other side of the scale, we've got more the event of there's the first one spike of on the black line of maybe that's one, like the first time you've knitted in a couple days. So you apply new force, you're well below the tissue tolerance. And then the next spike would be maybe you go to a convention or a party, and without taking rests, you knit or crochet for 6, 8, 10 hours of the day. That's a big spike in activity, and you pass that tissue tolerance threshold, which then makes the tendons and muscles pretty uncomfortable. The other important thing to remember in this situation too is that your tissues don't know whether you're knitting or doing anything else. All they know is the force that's being applied to them. So the amount of knitting that you're doing through the day is just adding to the pot of the other activities that your tissues are being used for, such as driving, working at the computer, cooking, cleaning. All of those have a cumulative effect on the total force that's applied to your tissues throughout the day. So if you are relatively inactive to begin with, and then on any given day you decide you're going to clean your whole house, search on the web for something on Pinterest or Ravelry to crochet or knit, and then you spend a few hours working on that project, that could be a big enough cumulative force to be a pretty drastic change from what you've done, your body's been experienced or exposed to in the past, and enough to pass that threshold. Next injury group here is neural compression, and we're going to sort of take a top-down approach with this and start at the spine and work our way out. So at the cervical spine in this picture, you can see the red lines refer to muscles that are put on tension, and in between each of the vertebrae, the bones of the spine, a spinal nerve would come out in between those. So a lot of times when we are working on the computer, working on a project, or just doing anything in front of us, we have a tendency for our lower spine to come forward, while our upper spine, right below our skull, tips upward to keep our line of sight up. So we end up having an overly flexed lower cervical spine and an overly extended upper cervical spine. So the muscles at the back of the head, sort of like if you've ever experienced tension headaches, the muscles that tend to get really cranky at the base of the skull are resting in a very tightened position, and the muscles in the front and sides of the neck are in a very lengthened position, when really they should be acting a little bit more evenly, rather than one side being overtensioned and one being overslacked. And this also leads to the little stability muscles that rest along our spine to be put in a position where they're overstretched, and it's a really hard way for them to contract. So ideally, with good alignment, we should be sitting with our ears sort of more in line with our shoulder blades, our head tucked back, to avoid any of those muscles from creating compression to the nerves that travel out of the cervical spine. And weakness in these muscles or any prolonged positionings in this forward head posture can contribute to a lot of other health conditions too, such as mouth breathing, congestion, jaw pain, or abnormal breathing patterns, the tendency to use more neck muscles to breathe rather than our big mover muscles along our ribs and our diaphragm. Working down from the cervical spine, when we get more towards the shoulders and chest, we have where our cervical nerves come together into the brachial plexus. So again, red is muscle, yellow is nerve. And when we're working on something in front of us, we have a tendency for our shoulders to sort of round forward with what we're looking at. As humans, that's just how our bodies are built. Everything comes forward to work on what's in front of us. But again, prolonged positioning here can lead to those pectoralis muscles, your pec muscles in the front of your chest, becoming a little bit tightened or shortened, and they lay right over top of all the nerves that travel into your arms. So that's a potential site of nerve compression that can then give you neurological symptoms either at the shoulder or farther down the chain. And then getting closer to the elbow and hand, we've got the two branches of your brachial plexus that are most often seen with nerve compression: the median nerve, which travels through your carpal tunnel, and your ulnar nerve, more commonly known as the funny bone. So most people have heard of carpal tunnel. It's a disorder of the median nerve as it travels through the front of your wrist and into your hand. And if you look at the picture of the hand that has the nerves laid out over top of it, at the wrist level, there's a bunch of little red tendons with little blue sheaths around them. Those are all the muscles of your fingers and wrist that work to flex your wrist or bring your wrist, your palm towards yourself. And your median nerve travels right along those. So if we're spending a lot of time flexing our wrist or tensing those muscles while gripping and doing small movements, that can create friction and swelling around that nerve and potentially contribute to tension or irritation of the median nerve. Another way that these nerves can get irritated is by resting your wrist or hand on hard surfaces while the wrist is laying in extension or sort of the wrist cocked up position, which puts tension on the carpal tunnel and can aggravate the nerve that way. Your ulnar nerve, or your funny bone, is that part of the elbow that we've all hit off of the wall or off a table at some point, and it sends a jolt down your arm. That ulnar nerve travels from the outside of your arm down to the pinky side of your hand. And it can be compressed a couple of different ways, either by pressure, so resting on our elbows on hard surfaces, or by prolonged periods of elbow flexion or elbow bending. So again, if we go back to that analogy of our nerves being like limp noodles, those noodles should go back and forth throughout the day, and our nerves have the mobility to be able to go back and forth as we move. But if they're spending a lot of time in their most tensioned position when our elbow is bent, then they're more prone to get sort of over tensioned and then become aggravated that way. And people will commonly feel numbness into their fourth and fifth fingers, their pinky and ring fingers, when this nerve is irritated. And then the next area that can be pain-provoking is posture. So I don't like to harp on posture, but when we're talking about activities where we have to spend a lot of time in a sedentary position, our posture becomes very important. So 3 key takeaways that I wanted to start with here in terms of posture. Number 1, frequent postural changes are way more important than perfect posture. Your body craves movement, but there are times of the day where we're not going to be moving as much. So trying to supplement those sedentary times with as much movement and variability as possible is usually better received by the body than just staying in one position for long periods of time. Number 2, even though a variable posture is better than the same posture, there are some positions that are more durable than others. So some positions that create either less neural tension, less muscular use to maintain the position, or less contact pressure that's going through the body based on where you're positioned. And then number 3, when we're thinking about how to set our posture, I like to take a bottom-up approach. And this is the same approach that I would take if I was helping somebody set up their desk at work, get more comfortable sitting in their car, or even setting up how to sit in a wheelchair. We always start at the hips and the base of the spine, because once we get that area set, everything else is going to fall into line a lot more easily. And then I included this picture of the knitter on the right here. So just take a peek at her positioning. As we go through the next few slides, we're going to revisit her at the end and see maybe what we would do different to get her into a more durable posture. So starting with a stable base, again, we're talking about this is going to be the most durable posture for most people that becomes less irritating with time or less prone to becoming uncomfortable. But again, variable postures and postural changes are going to be the most important. So starting at the hips, we want to be sitting on our ischial tuberosities, and those are our sit bones. So if you reach underneath your bum, you should feel 2 bony prominences or 2 hard pieces of tissue that most of your weight is on top of if you're sitting up tall. We want to have our weight dispersed over those bones rather than over the soft tissue of our low back if we are rounded or sitting more on our sacrum and tailbone area. The way that we can help get our body into this position without having to work really hard to sit up tall is getting your butt all the way back in the chair. So in the top picture here with the woman in the pink pants, she's leaned back, she's sitting a little bit more on her sacral spine, and this can probably be a comfortable position for a little bit, but eventually her back's probably going to start aching, maybe her tailbone and her hips. If she gets her butt all the way back in the seat, it's going to be a lot less effort for her body to keep herself upright, because her body is stacked on top of her stable base rather than just sort of hanging on top of the tissues that are spanning the back and hip. Your feet should be supported. So again, if your feet are dangling beneath you, your body has to work to prevent your body from continuing to slide in that direction. So having good support, whether it's a book or a box underneath your feet so that your feet are supported, makes your body work a lot less hard to maintain the position. And then having a little bit of space between the back of your knee and the edge of your seat is important too. So the woman who's in the bottom left with the purple sweater, the chair is right up against the back of her knees. And this is an area that I would be concerned about for contact pressure. So especially if she had any vascular changes in her body or tendency for sciatic nerve pain, anything like that, having that constant pressure at the back of the knee can easily aggravate all of the arteries, veins, and nerves that travel down the back of the knee and into the feet. So a lot of you are probably thinking, well, I don't knit in a kitchen chair, and neither do I. But if you're sitting on the couch, there are a lot of ways that you can help your body out so that you're not forcing yourself to be in a really upright position or forcing yourself to sit in a hard kitchen chair. So if you're sitting on the couch, again, start with getting your butt all the way back into the corner as much as you can. So if your butt's all the way back, it's going to be much more easy to sit upright without having to use a lot of those postural muscles in your upper back to do it. You can even roll up a little towel, blanket, or pillow and put it in the small of your back so that you can rest over top of it as long as your butt is all the way back in the seat. If you roll that up there and you're still slouched with your butt away from the back of the seat, it's not going to do you any good. Another part is either taking that rolled up towel, pillow, or blanket and putting it under your sit bones. So in the picture on the bottom right with the yellow chair, she has sort of a wedge pillow that has her hips higher than her knees. You don't necessarily have to go out and buy a wedge pillow, but using some of the things that you have at home to try to get your hips higher than your knees is going to, again, take out a lot of the work that your body needs to do to stay upright because it's already being supported into that direction. And then again, if your feet aren't supported, getting a book under your feet, a block under your feet, anything so that your body doesn't have to work so hard to keep your legs elevated. And for most people who probably spend their time knitting or crocheting in a recliner, that's completely fine too. But when you want to come out of that reclined position, try and get your feet supported as much as you can to get into that more durable position. All right, and I would be remiss as a physical therapist, and especially as a pelvic floor physical therapist, to not talk about how important breathing can be in terms of your posture. So real quick, I want everybody to put one hand on their chest and one hand on their belly, just above their belly button. And you're gonna take a deep breath in and out. And then on the second deep breath in, feel which hand is moving more, your chest hand or your belly hand. So breathe in and out. For many of us, our top hand on our chest is going to be the one doing a lot of the moving. And for a lot of that has to do with many of us carry our stress and our anxiety in our shoulders and in our neck area. So those areas tend to be more active than the muscles that are actually built for breathing. So your muscles built for breathing are the little muscles in between each one of your ribs, and then your diaphragm at the bottom of your lungs. And our lungs are meant to expand in 360 degrees, not just outward towards our chest, not just outward towards our belly, but they're supposed to expand in all dimensions in space. They even expand a little bit backward. It's not as notable of a movement because our ribs are more prone to expand forward than they are towards our back. But even lacking a little bit of movement with our breath towards our back can leave those muscles in sort of a chronically tightened and short position. So it's almost like if you have a clenched fist all the time, those muscles are going to start to get sore. So ways that we can start to think about our breathing while we are knitting and trying to maintain these postures, or really any time throughout the day, is trying to guide our breath into some of the areas that it might be lacking. So a couple of the places that I'll cue people to put their hands is either take your hands on each side of your rib cage and take a breath in and try to breathe into your hands, expanding out to the sides. Or you can put one hand on your belly and one hand on your low back. And as you inhale, try to breathe into your hands. So again, as you inhale, you're picturing that you're expanding your trunk like a balloon. And as you're exhaling, that balloon is deflating. So an efficient breath should look something like this. You should be inhaling through your nose. If we're in that forward head positioning, it's going to be really hard to breathe through our nose because it feels like everything's getting closed off at the back of our throat. Once we get that head tucked a little bit more, it's a lot easier to breathe through the nose and less prone to use our mouth or our jaw muscles to breathe. So we're inhaling through our nose. Our diaphragm, the muscle at the bottom of our ribs, should be dropping to allow our ribs to expand in 360 degrees. And then on the exhale, everything returns back to rest. And it shouldn't be a forceful movement. You shouldn't feel like you are pushing your ribs out or pushing your belly out. It should feel like you are just passively inflating them as you breathe in and deflating as you breathe out. So this is something that I highly recommend that if it's not something that you have practiced before, take a peek at it in your own, like on your own time throughout the next couple of days and see if you tend to be more of a chest and neck breather, more of these accessory muscles that were never meant to be breathing every single breath for us, or if you're using those good rib and abdominal muscles to actually expand. And again, this is something that I commonly see with people who are experiencing more positional type back or neck pain. So if I sit on the couch for a while, or if I'm standing in line at the grocery store or lying in bed, these areas tend to constantly tighten up for me. I frequently start with the breath for people to see how their body tends to utilize those muscles and if they're being overused. All right, but back to more of the positioning with posture. So if we're working our way up from that stable base, going up to our neck, again, we're trying to avoid that forward head positioning where everything's in front of our body, and you're trying to think of stacking your head so that your ears are in line or roughly in line with your shoulders. Another way to help this is making sure that if you're looking at something, if you're a skilled enough knitter that you don't need to look at your work, make sure that you either have your TV, your book, or the pattern that you're working off of at eye level so that you're not prone to start looking down or looking up and getting into the forward head positioning. Our shoulders and elbows are also an area that can start to get overtired or uncomfortable with prolonged positioning in front of us. So instead of holding your knitting and your work in front of you, try to have something else hold the knitting for you. So this picture at the bottom, the woman in the second picture has a pillow on her lap so that her forearms can rest on top of it. Or the other option would be putting a towel or pillow behind your shoulder and against the chair that you're sitting on so that it is holding your arm in front of you rather than you having to actively hold your arm in front of you that whole time. So little changes to the positioning that can make a really big difference in how much loading your tissues are getting throughout the movement. And then if we're looking at our wrists and hands, this is probably the area where the most people experience issues, is either feeling wrist or finger pain. And our wrists are meant to move in multiple planes, both flexion and extension, so go into the palm side and the back of the hand side, and then radial and ulnar deviation, which is moving towards the pinky side and towards the thumb side. A neutral position would be if we could take a straight line through the forearm and into the line of your third finger. That would be neutral both for radial deviation towards the thumb and pinky, as well as flexion and extension. So neutral is in the line of the forearm and the third finger. A lot of times when we find ourselves knitting or crocheting, we're more in this position or a variation of any of those positions for pretty prolonged periods of time. And whether if it's just for one stitch you go into that position, or if it's every stitch you're living in that position, that adds to the cumulative load of those tissues. So trying to look at your hands more frequently. You're never going to be able to maintain your hands in perfect neutral for all knitting, because that would just end up being really inefficient. But if you're starting to feel some discomfort in your wrists, or if you feel like that could be something that you are prone to, checking in with your positioning periodically to try to get yourself into more of a neutral position rather than any of those varied bent positions is a really nice way to make sure that those tissues are not being overused. And I recommend check on this frequently. Set a timer or set a reminder on your phone, or every time the TV goes to commercial, check your hand positioning to see if you're starting to gravitate into any of those end range positions. And finally, with posture, we want to make sure that we're reducing contact pressure. So I already talked a little bit about making sure that there's some space between the base of the chair and the backs of your thighs so that you're not getting any compression at the backs of the knees. At the elbows, especially for the ulnar nerve and the funny bone area, that nerve does not like to be against any hard surfaces, and it doesn't like to be bent for long periods of time. So trying to get your forearm supported on a pillow or having something more cushioned underneath your elbow is a good way to make sure that that area isn't getting overly compressed. The wrist, again, this is an area that is really prone to getting sort of that overuse with a lot of our other daily activities. So if you are mousing on the computer, checking to make sure that you are not living in a position of a lot of wrist extension or a lot of wrist flexion, and instead trying to have your mouse set up so that if your hand is resting, you want that line to be nice and neutral between the third finger and the forearm. So sometimes I'll have people roll up a towel or something small underneath their forearm to support their arm rather than having to rest on the table or keep it elevated off of the desk. And then finally, our fingertips. So the types and sizes of needles that we use exhibits different pressures against our skin. So with like your level 1 physics course in college, if any of you have taken a physics, pressure is inversely related to area. So if you have two objects that exert the same force, so let's say it's like a can of soup. If we have a 16-ounce can of soup that's really tall versus a 16-ounce can of soup that is really wide and has a big base, that tall one that's very thin is going to exhibit more force down than the wide can of soup. Or similarly, if somebody pokes you with their finger with 10 pounds of force, it's going to feel different than if somebody pushes you with their whole hand with 10 pounds of force, because that force is being more evenly distributed. So if you have arthritic fingers or bony fingers that are sensitive to pressures, leaning more towards the larger size needles or square needles that have a nice flat edge to put against your skin is a nice way to make sure that that force is being evenly distributed through our tissues and not put through one small area. All right, so swinging back to that original knitter I had at the beginning, some thoughts on things that she could maybe do better to get into a more durable position. If we're starting at her base, I would love for her to get her butt all the way back in the chair so that she is better supported and better sitting on her sits bones. Working her way up, she is definitely in some forward head posture with her head looking right down at the work that she's doing. So I'd love for her to pull her neck back a little bit so that her head is more stacked on her shoulders, at least periodically. She can spend some time in this position, but trying to make sure that she visits those other positions so that she's not overloading the tissues too much would be a good idea. Her elbows are really bent and right on the hard wooden rocking chair, and that just seems like it's going to get uncomfortable for her ulnar nerve pretty quickly. And then her feet are sort of swinging off of the chair, which again, it's a rocking chair, so maybe she enjoys that, and that's probably good for a little bit. But having a book or a stool that she could scoot underneath her feet periodically would probably be a good way to make sure that her body isn't working harder than it needs to. But I will say her wrist angle is pretty good, so no corrections there. All right, getting a little bit more into the nitty-gritty of actually using our tools in front of us. So when we are trying to convert a stitch or slide a stitch off of the needle, a lot of times people will push those needles with one finger off the edge. Or they will actually push the edge of the needle with their fingertip repetitively every time that they move a stitch or bring a stitch around. Either one of those ways involves little tiny micro movements of either pushing with the finger or pushing the loop forward that creates a sort of low load repetitive overuse. So instead we can sort of use the tension in the yarn to our advantage. If you bunch all of the yarn loops up to the end of the needle, they're all going to want to spring forward. And if we have them all bunched up together, it's going to take very little force to push them over the edge because they're going to want to go that direction already. So have the yarn work for you rather than you working for the yarn. Excuse me. Probably one of the biggest ones is trying to avoid the yarn tensioning techniques that involve holding a finger up or constantly moving a finger up and down. So those can be ways that we can get the little tiny extensor muscles of our fingers and wrist really tired really quickly. So it's very common for people to hold the working yarn up with one finger or to wrap it around a couple times so that they don't have to hold it up quite as high. But that's putting all of the force of tensioning the yarn onto one finger that has to stay active the entire time that you're knitting. So there are a lot of different yarn tensioning techniques out there. I highly recommend looking them up on Google or on YouTube if you haven't used any of these strategies already. He's got a good picture here that he uses, and I found that I've had to play with a couple different styles to find what works best for me and what allows me to still work efficiently. And I will say that it takes a lot of practice to get used to a new yarn tensioning technique, because chances are you've spent hundreds or maybe even thousands of hours practicing this movement with the same yarn tensioning technique every single time. So your brain is very ingrained in that pattern. And anytime that you start a new pattern, your speed, your efficiency is going to drop quite a bit. But in the long run, it's really going to help your efficiency, because you're not going to have to take as many breaks because your fingers or your wrist are hurting, and you have less risk of injury. That's going to really take away your productivity in finishing your products or projects. And then another thing that the author mentions in the book that's really fascinating is considering what needle that you are pairing with your yarn. So a really silky yarn and a really slippery needle ends up being a lot of work for you, because you're trying to prevent the stitches from slipping off the needle all the time. And conversely, if you have a really dense friction yarn with a high friction needle, you're going to have to work really hard to push those stitches along. So the author recommends using that friction to your advantage and trying to pair a needle that has more friction with a yarn that has less friction, so that they're holding onto each other just enough, but you don't have to work really hard to keep them from falling off or to push them along. And what he recommends is, if you're not sure about the friction, chain a row or knit a row, and once you have them on the needle, turn the needle and point it towards the ground. So the point side is towards the ground. If they slide right off, you don't have enough tension between your needle and your yarn. If they don't budge at all, then you probably have too much tension. Ideally, you want to be able to shake it a couple times, and then it'll slowly start to make its way down, but shouldn't just slide right off. And then another thing to keep in mind, if you're trying to use a more slippery needle and it's still giving you too much tension, keep in mind that the oils and perspiration from our hands can build up on our needles and increase the friction that it has between the yarns. So make sure that you're keeping your needles clean too. Here's a chart that I included here that's from the book, and it's some of the more common materials used for needles and some of their properties and things to consider when you're choosing yarns to pair with them. I've included this here for anybody who wants the slides afterwards, because it's a pretty good reference. And then with any project, we want to make sure that we are managing the repetition of any of our movements. So knowing a couple styles of knitting or crocheting is always helpful. So if you typically are a continental knitter, but that's starting to bug your hands or bug your wrists, being able to switch to English is a really nice way to stay productive without moving into those painful movements as much. Making sure that you're giving your body breaks from any of the repetitive movements is really good. And keeping a couple active projects is a nice way to make sure that you're not spending too much time doing the same thing over and over. So if you're doing a small lace project with a really small needle and a really small thread, it's nice to have that going at the same time as more of a large scale project with larger needle and thread or needle and yarn, so that you can diversify your activities enough so that you can stay productive on both, but not get burnt out on one while working on one in solidarity. And then adding in movement as you knit is a really easy way to break up the monotony and the repetitiveness of sitting or any of those repetitive movements. So some examples could be, if you are knitting some ribbing, do some heel raises with your feet on the floor each time that you knit a stitch, or kick your knee out every time that you purl a stitch. If you're doing a really simple single color row, a very simple stitch, maybe try standing while you're doing that. If you're unwinding a length of yarn from your working pile, maybe you stretch your neck back and forth a little bit, or do some seated twists. But you can really get creative with these and use sort of those pause moments in your projects to get some movement. So if you are checking up on your pattern, or you just finished a row, use that as an opportunity to either change position or move your body around a little bit to break up those long-term positions. And then some tools of the trade that you're all probably aware of if you've been knitting or crocheting for a while. The winders and spoolers, and then more of the cart style bags rather than over the shoulder bags for knitting can be really nice ways to reduce the repetition of movements or postures that you're doing while you're knitting and save that energy for when you're actually working on your project. And hopefully this isn't the case for anyone here today, but what if too late you're already in pain? What are you supposed to do now? The good news is that most orthopedic symptoms related to repetitive overuse are self-limiting and will typically resolve on their own with time. But the bad news is that now you're probably behind on your projects. So when in doubt, I always recommend that you talk to your primary care physician or a trusted physical therapist first. But it comes down to, should I knit or should I wait? So in the event of tendinopathies, some signs and symptoms of these would be pain with active movement. So if we're looking at the wrist, pain with active movement could be lifting or extending the wrist. You get pain with stretch into the opposite direction, so dropping the wrist to palm side, and then pain with resisted movement. So lifting the wrist against resistance would be painful. Some acute level symptom management that can be helpful is ice, anti-inflammatories over the counter, and relative rest. And as it's starting to feel better, you can start to reintroduce activity. So if your symptoms are still really persistent and unrelenting after 2 weeks, it's probably time to go see a healthcare provider. But if they're starting to feel better, start reintroducing some of the symptomatic activities slowly. So I educate a lot of my patients on the red, yellow, and green light rule. So a green light would be you're doing the activity and you have no pain during and no pain afterwards. That's a green light. Do that as much as you want. Yellow light would be you have a little bit of pain during, but as soon as you stop, the pain goes away immediately. That would be a yellow light, so you want to keep an eye on that. You don't want that pain to be increasing with repetition or sticking around longer than that short period afterwards. Short period meaning maybe like 20 minutes or so afterwards. And then the red light would be you have pain during and then it doesn't go away afterwards. That's an activity that you definitely want to hold off on for right now. Another thing you can try is another technique. So if it's painful to knit English, then you try continental. And also make sure that you are optimizing your positioning with some of the ideas from this lecture, because maybe it's as easy as having your arm supported or your wrist supported takes off a lot of the pressure and you're able to now do that activity with a lot less discomfort. In terms of neural compression, there can be a really wide range of symptoms, varying from numbness, tingling, deep achiness, searing pain, loss of sensation, or strength. In terms of management, as long as there's no swelling to the area, you can really use ice or heat or rest, whatever feels good. There's no contraindications to using ice versus heat. And in the event of neural compression, if you think that's what's going on, it's usually best to see a healthcare provider because our nerves travel such a long distance in our body. It can be really hard to narrow down where the compression is coming from, and it's going to be easier for your healthcare provider to do that than for you to try to figure that out on your own. But this is a good opportunity to diversify some of the things that you're doing. So our nerve function is so imperative to our health. Don't sacrifice your nerve function just to finish your project. And if you are having nerve pain, use this as an opportunity to update maybe your project book on Ravelry or Pinterest, try a new craft, or maybe organize your stash so that when you get back to things, everything's in the way that you want them to be. And then osteoarthritis is definitely a big one in here. Just a little preface on osteoarthritis and what's really going on. OA is a degeneration of the cartilage that lines the joints. So if you've got a bone here, those are both made of osseous tissue, and then they have a lining of slippery cartilage on the ends of them so they can slide past each other nicely. With osteoarthritis, that slippery cartilage starts to become a little bit more rough, and it's a lot harder for the joints to move past each other, and it can make them painful or really stiff. So the signs and symptoms of those is typically joint stiffness, especially after periods of inactivity. So waking up first thing in the morning, long car rides, or sitting for a long time knitting, and joint pain with loading. Loading meaning adding resistance or adding active movement against a pressure. So ways to help with these, so if you have active arthritis in your hands or wrists or your back, getting those areas warm tends to feel really good. It helps to increase the production of synovial fluid, or the joint fluid that's in the joint, and makes it a little bit more slippery, which can make the joint a little less stiff when moving. And keep in mind that motion is lotion. Since osteoarthritis tends to get stiff with lack of activity, try to keep your joints moving as much as you can throughout the day. So if you have low back arthritis and sitting for a long time tends to get your back feeling stiff, that's a really good indication that you should probably move more when you're knitting. And then same with your hands or your wrists. If the only time that you're really using your hands or your wrists repetitively throughout the day is when you're knitting, it's probably going to be a good idea to try to move them a little bit more throughout the day so that they're not tightening up throughout the day or getting stiffer throughout the day. And then I'd be remiss to not say that non-weight bearing exercise and resistance training is really important in the treatment of osteoarthritis. So working on your strength and mobility of those joints without resistance at first is a really good way to get the tissues moving a little bit better again. Some additional considerations to keep in mind, again, as a physical therapist, I'd be remiss not to add in that keeping up your cardiovascular fitness between your knitting sessions is really important. We've all had a project that we just want to bang out and work on really hard, but making sure that that's not the norm every single day and we're spending our entire evenings or our entire mornings knitting and sitting on the couch is a good way to make sure that we are not inadvertently deconditioning our bodies. A good starting point that one of my colleagues led me to is called Walk with Ease by the Arthritis Foundation. They have a step-by-step program of how to increase your walking levels if you're not walking regularly, and some basic stretches and strengthening activities that can be good for arthritic joints. On top of that, don't neglect resistance training, especially for your postural muscles. We're trying to use our positioning to make those muscles not have to work as much as possible, but they do have to work at some level. So making sure that we're keeping those areas strong is really good for our longevity and our posture for all activities. And when your body talks, listen to it. So if you are having to shake out your hands 5 times in the past 5 minutes, or you're constantly shifting because you're uncomfortable, your body's probably telling you that you're due for a break. So listen to your body. Don't try to push through pain, because pushing through pain now is probably going to be a bigger beast later down the road compared to if you just rest now, you're going to give your body the rest that it needs. And keep in mind that change doesn't happen overnight. Set maybe a small goal to start with and then start to stack on top of that. So maybe you start with, all right, this week I'm going to make sure that I have a stable base when I start knitting, and I'm going to try to move my body every time a commercial comes on TV. And then once you're getting consistent with that, be like, all right, maybe I'll change the way that I'm tensioning the needle, because I know that's going to slow me down for a little while, but I don't have an active project going or a due date. So I'll try some of these new techniques. And as you get the ball rolling, you can start to add in more of those ergonomic changes to optimize your performance when knitting and crocheting. But that is all I have for you guys today. I had to include some pictures of my crochet buddies, my husband, our dog, and our 2 cats, who are frequently hanging out with me when I'm crocheting. And I hope you guys all learned something from this today. This was really fun to research, and